Good afternoon. Thanks for joining us. We have some really great news today. I can announce that our state has been remarkably successful in increasing the vaccination rate for state workers. And nothing could give me more delight than knowing that our state employees have stepped up to the plate and have become vaccinated, which protects themselves, their families, and importantly, the public, to battle this horrendous pandemic. As you know, our progress has been very significant. When we started this effort, we were at 48% vaccinated in state employment. Today, we are over 90%. We are over 90% of total state employees have become vaccinated. And if you add those who have had an exemption and have been accommodated, we are at, I believe, 91.7, if I can see our graph here. Josie, I hope you're putting up here so people can see it. We started at 49.1% on September 6th. We went up to 68% on September 20th. We now are at 91.87% as of October 4th. That number actually has gone up since then and has continued to go up every single day. This is extremely gratifying. It is gratifying because we now know there will not be a mass exodus of state employees, and we will be able to continue essential state services for the people of the state of Washington. The verification deadline for employment is approaching Monday. That deadline will not be extended. People have had 10 weeks to get vaccinated. We've had plenty of opportunity and access to the vaccinations, and people now need to make a choice. So more than 9 out of 10 state employees have been vaccinated. As of Monday, we'll report additional numbers, and that will increase. We also believe there are quite a number of employees who have been vaccinated but have not yet returned their status to the agencies involved. Now, we have been successful in this effort because in Washington we have state employees who are committed to public service and who've made a decision to keep the public safe, to try to prevent increasing rates of infection. They care about the people they serve as well as their own selves and their families. We know the pandemic has thrown challenge after challenge against these state employees, and we appreciate their work. Some individuals who choose to walk away from their state employment, we want them to know that we have appreciated their service to date, and we wish them well. But I want to express my total appreciation of those state employees who have answered this public call and have made a decision to protect the citizens they serve. We are deeply grateful for that decision, and frequently for those folks that has not been an easy decision. I've talked to our agency about these numbers. It's going to allow us to continue our essential services. We're going to keep operating just fine, in part because of the dedication of our state employees. There might be some operational changes in agencies, but they have provided a way to do that. We are capable of handling those changes because we have had so many employees step up to the plate in the last few weeks. So I'm optimistic also that these numbers will continue to grow even after October 18th, because I believe there will be those who will make a decision after October 18th to return to their jobs if those jobs have not yet been filled. We hope that that will be the case because we value everyone's service and we would like everyone to stay in public service with the state of Washington. Yeah, I have an announcement today regarding our continued efforts to fight this continuing pandemic. I am thrilled about the vaccination rates of our state employees, but we know we have to continue to accelerate our efforts against this deadly disease. Statewide, over 70% of Washington's over 12 have been vaccinated, but we've got to continue to increase that vaccination rate. There are still 1.6 million Washingtonians 12 and up who have not started their vaccination, and more children below the age of 12. Now, we know that our cases as a percentage of the population happily have been going down. They have been showing some decline. But we know they can come right back up. So it is especially important to increase our vaccination rate for our children to allow them to stay in school. We're very happy our kids are back in school, but we will not allow another wave to shut down our schools or our businesses. So we are committed to continuing these diligent efforts. If we can look at the epi curve, there's a pretty obvious reason why increased efforts are necessary. There's a pretty obvious reason why the status quo is not good enough. And there's a pretty obvious reason of how important this issue is to Washingtonians. We have lost over 8,000 Washingtonians to this dread disease. And what we know about it is you can knock it down, but it gets back up. If you look at our epi curve starting in April 2020, we had a sharp curve. We were thrilled when it came down. But if you go to July 2020, it came back. And we were thrilled when those numbers came down. But again, in between October and January 2021, it came back. And we were thrilled when they started to come down in late January. But then in July, we've got this precipitous rise again. We cannot and we will not surrender to this disease. We cannot and we will not think that the status quo is good enough. We have got to get on top of this disease and knock these numbers down. And fortunately, and it is our good fortune, we have a tremendous weapon to do that with, and that is this vaccine. And we intend to continue to deploy that weapon against this disease by taking measures that we know that work, and that is to get more people vaccinated. So, today I'm announcing a vaccine verification requirement for large events in the state of Washington. Effective November 15th, large events in Washington state will be required to verify that their attendees are either fully vaccinated or have received a negative test within the previous 72 hours. This applies to attendees who are 12 and older. This applies to indoor events with 1,000 or more attendees, and this will apply to outdoor events when there are more than 10,000 attendees. For now, this applies to ticketed or registered events that have defined entrances, like conventions, concerts, sporting events, fairs that have defined entrances, theme parks, and more. This does not cover large venues like shopping malls, museums, or grocery stores that are open to the public as part of their operations. Religious services will be exempt from this requirement, as are K-12 school-related events that occur on school property. There will be several ways to verify vaccination status, beginning with the CDC vaccination record card or a photo of that card. A printed certificate or a screenshot on your phone from myirmobile.com works. Other official immunization records from health care providers can also be accepted. Confirmation of a negative COVID test in the last 72 hours can be done using the records provided by the test provider or laboratory. So this is yet another step in an ongoing battle with this disease. We believe it is a very important one. It can help incentivize people to decide to get vaccinated and avoid the headache of having to get a test. We believe it will be yet another effective of the measures that we have taken that have shown effect during this disease. And I think it is important to note the things we have done have benefited people and saved thousands of lives. Our state continues to have one of the lower death rates in the United States. We want to improve that situation, and we will continue to take these steps in this direction. Now, we know that outdoor venues are safest, but they still have some transmission risk, and that's why we've taken the steps that we have. We also know that more people are gathering at large events now than they have in the last year and a half. That's a good thing, but we need to continue this effort because not only of this variant, but there could be others down the road as well. Nearly half of the world's population, more than 3.7 billion people, have received at least one dose of one of these COVID vaccines currently available. We know that these vaccines work, and that's why we're taking these measures. With that, I want to see if Dr. Shah had some comments before I come back and address a couple other issues. Dr. Shah. Oh, you're here. Excuse me. It's remarkable people show up in this new era.
Thank you, Governor. My name is Dr. Shah, Secretary of Health for the great state of Washington. And I just want to start by saying a few things. One, that we're continuing to work with our partners to increase vaccinations across the state. And I think that is the key theme for this action today, as well as our continued actions over time, is that we're still not out of the woods. We have a lot of really important work ahead of us. We have thankfully started to see a flattening and a decrease in cases and hospitalizations, but as the governor showed, they're still at an extremely high number, and this is the highest number that we have had. We're still at the highest number we've had throughout this pandemic in this fifth current Delta wave. So disease trends are absolutely showing improvement, but because they remain high, it's important for us to continue to stay vigilant with the work that we are doing. Hospitalizations are also decreasing, as I just mentioned, and I do want to make mention of one additional fact, which is the majority of people who are hospitalized with COVID-19 in the state of Washington are simply not vaccinated. And so this is a preventable disease now, and yet our hospital systems, our healthcare systems continue to be stressed, they're stretched, and they're strained, and we need to do everything we can to support our healthcare system, as that healthcare system is here to help all of us. The future of the trends, which direction these trends go, they continue to come down, they continue to improve, or if they go back up, really is going to be up to all of us, and that includes vaccinations, doing our part to get vaccinated or to champion vaccines for others in our community, but also to be frank, we have to continue to mask up and do all the things from the prevention standpoint to help ourselves have the best chance to fight this pandemic in our state. Flu season's also going to have an impact. We know flu season is right around the corner. We want to encourage Washingtonians to get the flu shot, help mitigate the impact on our healthcare system further, and certainly we want people to protect themselves and others. I want to give an update. As you may have heard, we have been over the last few weeks working with our federal government related to federal resources to support the healthcare system throughout the state of Washington, and they are coming our way. The GSA contract that we have referred to over the last several weeks with the ACI as a subcontractor staff are now in process. We've actually had those staff members, those contract staff members on the ground here in facilities in Washington. We're also expecting federal resource deployments that will be beginning to arrive, especially in eastern and central Washington, starting as early as late this week into some point next week. So it's really great that we've had this support from our federal partners. As you know, the ASPR, the Assistant Secretary for Preparedness and Response, was here last week in Seattle area and assured us that we would get the resources that we would need in the state of Washington. But the federal system is strained right now and the deployments are limited, and so we have to do our part as not just the state, but all Washingtonians to, as the governor says, pull on the rope. And I think it's really critical that we continue to do that. Let me also say just one last thing here related to holidays. We're about to get successive number of holidays that are coming up, and it starts with October 31st, Halloween. I want to make sure to remind everybody that if you're going to be out and about with a mask on, it's not the same mask, that we want to make sure that you are not having just a costume mask, but a true mask that's going to protect you or your children, your loved ones. Please avoid large gatherings around Halloween, but also around Thanksgiving and later holidays. I will say that Thanksgiving is just 6 weeks away. So we want to make sure people are doing what they can to mask up, avoid large gatherings, and certainly with the holidays approaching, to get vaccinated. So the last thing I would just say is that if you haven't done so already, please do your part to help us fight this pandemic. The numbers are continuing to be at a rate and a number that is extremely high in terms of hospitalizations and cases, but we are confident if we work together, we will continue to be able to see the success in our state and once and for all be able to end this pandemic. Thank you. Governor.
Thanks, Dr. Shah, and your hard-working team. They've been working really hard through this, and we really appreciate that. Comment about forthcoming rules by the federal government regarding vaccinations. We're still waiting the details of the OSHA proposal. We're advised that the first draft of that is going forward, and we will make some final decisions when we see that rule and its details. But I'm told that from the federal level might involve having a test out option so that people would not have to get vaccinated. I have been clear in our state's position that we have not found testing to be an adequate protection against this disease. As I've mentioned previously, we tried that option with our Department of Corrections to allow employees to not be vaccinated and just take a test. Unfortunately, that resulted in very, very considerable transmission in our facilities, some of it coming from our DLC employees. It simply did not work adequately to prevent transmission of the disease, nor did it protect our DOC employees. We now have had several loss of life of our Department of Correction employees to COVID. Test set options was not adequate. So I do want folks to know that we were going to look at this rule, but we will be actively considering not having a test out option in the state of Washington when that rule comes out. That is something we're giving careful consideration to. We may make some additional changes to the federal rule so that it will be more consistent with our rule in the Washington state. It makes sense potentially to eliminate the test out option so that we will then have a consistent practice and policy throughout the state of Washington, both in public and private enterprise. So we know that testing will not be the end of this crisis. The vaccine will, and that's why we're committed to this course. Other good news, we are very pleased to hear the news that the administration has opened up the border to vaccinated Canadians. We're looking for the day for them to come visit us again. This has been very frustrating to many of us, including myself, that it has taken this long to open up that border. I have been helping many other folks work on this issue. I was on as recently as Tuesday morning, I was on a call with the White House officials involved on this issue and was pleased that night that they announced that they would open the border. That's great news. We do want to work with communities to help them get a testing capability, because when people come from Canada, according to Canadian law, they still have to get a test to return to Canada. So we're going to be working with our communities to have as easy a test option for the Canadians so they can get back home. We love Canadians, but we know they want to go home too. So we're going to work with folks, including I've been in conversations with the folks at Point Roberts to find a solution to this problem. Dr. Shah is working on it. We want to help these communities in that regard. So with that, happy to stand for questions. You may fire when ready. Gridley.
Governor, with the booster eligibility likely to expand to more groups soon, are boosters going to be part of the state's vaccine mandate moving forward?
We have not made a decision on that. So we just have not made a decision one way or another in that regard.
And then as it pertains to state service, I know you said that there won't be massive disruptions, but some areas of the state, some sectors are going to feel staffing shortages more acutely than maybe others. So has there been any thought, being that the vaccination rate is so high for a majority of the people who are covered under your mandate, to offer some flexibility for accommodations for those who have received medical or religious exemptions but haven't yet gotten a job accommodation?
Well, no, we are not changing our policies. We're following the law regarding exemptions and accommodations. We do not anticipate changes in those policies. There are individualized decisions made dependent on the individual employee's job and what they do or do not do. Each agency has been working on an individualized basis to assess those. Some job categories are obviously more difficult to accommodate than others because some involve extended interaction physically with the public and with their co-workers. So there has been an individualized decision on accommodations. But we do not anticipate making any changes to our existing policies, no.
One last question on testing. I know you had said that testing didn't work when you guys tried that before, but because there are breakthrough cases among vaccinated people, wouldn't it be helpful to incorporate testing more frequently among vaccinated workers who may be asymptomatic and still going to work and spreading the virus?
So those are things that we could consider at some point. We haven't got any decisions in that regard right now. We wanted to focus on vaccination because that's the ultimate weapon against this disease. It's the one thing that we know really, really works in saving lives by the thousands. And it is the thousands. So we wanted to focus on vaccines. We know that while masks can be helpful, only the vaccine can prevent us from getting hit by another wave. And that's why we have focused on vaccines at this moment. And I'm confident it's going to work. It has worked. Look, when we started this, critics were saying, you know, this was going to destroy state government. People would walk away in droves. You're only at 48%. But we were confident that state employees, when they started to think about this, would become vaccinated. And that was right. They have been. And I'm very appreciative of them doing that so we can continue to serve the public. So that's why we're focused on vaccines.
Governor, I've heard from a lot of concerns from families of incarcerated people on the state of DOC facilities now and how that may change on Monday, and especially in facilities that could lose 50+ people when that mandate goes into place. Are you confident in the contingency plans, and is there any thought of bringing in the National Guard or other contracted workers to avoid things like 23-hour lockdowns?
I am very confident in our ability to fulfill our obligations to incarcerated individuals. I've had several discussions recently with Cheryl about this. She has good plans to deal with this. The numbers have gone up rapidly in the Departments of Corrections and will continue to do so even in the next few days as they turn in their cards. We think some people, in order to register their displeasure, are not showing us their vaccination status till the last few hours. We understand that, but these numbers are going to go up. So no, I feel very confident we will be able to fulfill our obligation to these incarcerated individuals and to the staff that are working. Now, that doesn't mean there might be some changes in staffing assignments. It doesn't mean we may not bring in some other people from headquarters to serve on location, but we have plans to do that. I am very confident in our ability to weather that storm.
Governor, a question for you and then one for Dr. Shah for tonight. You know, there may be what some people see as a mixed message on testing. If testing is okay for indoor gatherings of 1,000 people or more, why isn't it also okay as an alternative for state workers?
The reason we're having a test out option is that in order to deal with the religious exemption and medical exemption issue, it's very difficult to ask a football team to assess the religious or medical exemption requests of 70,000 people. So in order to accommodate that, we've opened up that door to folks. It's the only realistic way we thought to really handle this in a practical way. So that's the reason we've allowed it for the particular arenas. In a vocational standpoint, the employer who sees the same employee every day can ask for an assessment of the ability to be accommodated in exemption. That's very not easy to handle, but we have found it success handling it. You just can't do that when people are trying to rush into a football stadium. So that's why we took that position.
And Dr. Shaw, question for you. You said earlier that we are not out of the woods yet. What are you looking at? How will you know we are out of the woods and can ease up on some of these requirements?
Yeah, no, thanks for that question. So there are a number of things that we're looking at. One, we're looking at what's happening in the community and with respect to cases, but we're not just looking at a point in time, we're looking at trends. The other thing that we're doing is looking at what's happening in our healthcare system. So again, not a point in time, but trends. And so it's a combination of that, but we're also looking not just at cases, hospitalizations, also vaccinations. What are the protections that we're putting in place for individuals to be protected, for communities to be protected? The last thing we want to do is to improve and see improvements in our system, our healthcare system, as well as in the community, and then let off those restrictions and immediately see a rebound. So we want to feel confident that that rebound isn't going to happen, that the trends are going in the right direction. Remember, we are very concerned about this upcoming fall, winter, when people are going to be indoors and weather changes, flu season. People are, around the holidays. We're very concerned about a rebound, so we want to do everything we can to continue to drive this down. And the number one thing we can do for that is to get people vaccinated.
Can you assign a number to any of those factors?
Again, it's a trend. Let me back up and say this. So there's absolutely as they say, science to medicine. There's also an art to medicine. There's a science to public health, but there's also an art to public health. And what we do is we look at summation of a number of factors, but we're also looking at what do we think is going to happen from a modeling standpoint, a forecasting standpoint. If you let off on one certain mitigating factor, let's say masking or some other factor requirements, what's that going to do in the system? What's that going to do for our case rates? What's that going to do for our hospitalization rates, et cetera? So we don't have a specific number. And I've been asked this question for a year and 20 months, I'll be honest. I've been asked this question, a year and 10 months. I've been asked this question for a long time, which is there a number? And I wish there was a number. I could say it's 5, it's 10, it's 20, it's 5 per, 10 per. There isn't a number. It's trends, it's an overall context, and it's also making sure that things are getting better and that our modeling and forecasting doesn't make us believe that we're going to potentially get into trouble if we prematurely take off those either restrictions or those requirements. So, thank you.
Could I add something to
Sure.
that?
Yeah.
Look, I know it's frustrating to people that there is not a magic number. It would be a lot easier for all of us if we could give the public that. But I can say this, the magic number is 1. And that means every single person who decides to get a vaccination accelerates the day when we're done with all of these things like masks and vaccination, right? So all I can say is to the people who are frustrated that we can't give a finish line of this today, what we can say is that finish line gets closer if you get vaccinated. So help us out here. Let's get through this. We don't want to have to wear masks forever. So help us get through this problem if you're frustrated and get vaccinated. And more people are doing that in state employment. By the way, I want to thank all the educators and the healthcare workers that are also responding to this. We've had a dramatic improvement in those fields from people who are stepping up to plate. Our educators have been working so hard to keep their kids safe, and now they're having increasing educators who are getting the vaccine. Our healthcare workers who've been heroes every single day, coming into these things with COVID all through their institutions and walking right into the trouble. I cannot tell you how much we hold them in our hearts. And they now have increased their vaccination rate as well. So this vaccination program is working throughout our multiple industries in the state of Washington. And we want to thank everybody for that.
Governor, the restrictions you're announcing today to go into effect in a month, in a lot of places, they're already doing that. The Kraken, the Seahawks. Why do we need this? When you see these numbers coming down, people are just going to say, there goes the governor again with more restrictions. Why do something that, for the most part, is already being done?
Well, not everybody's doing it is the reason. I mean, not every concert's doing this. Not every arena is doing this. Not every sporting event is doing this. It's because not everybody is doing this. And we're trying to get a more uniform approach to this so that we can get through this vaccine. maybe the simplest way to say this is what we have done to date is not adequate. What we have done to date, the status quo is not adequate. We do not have enough protections. We do not have enough people vaccinated to give Washingtonians confidence that this number, this wave, another wave is not going to hit us. We cannot have confidence of that until we have thousands of more people become vaccinated. But let's count our blessings here. The good news is we have a tool to get to that position, which is the vaccine. Imagine the position we'd been if we did not have this vaccine. Remember where we have been in this. We've been where our whole economy was shut down. You couldn't go to a football game, you couldn't go to work. But now we have the vaccine to restore all of those. And we've found a way to restore much of our normality, but we're not there yet. We want to get back to a situation where we do not have to have these press conferences on this subject. So we're asking people to get vaccinated.
Governor, I want to go back to the question Rachel asked about the people who've gotten exemptions but not accommodations. It seems the state is taking a particularly hard line under your direction, which was that for public-facing employees, masking up, even double masking, testing, other kind of mitigation measures are not sufficient. And as a result, if you are public-facing and you get an exemption, you very likely can't get an accommodation. And as a result, it appears that the vast majority of people who will leave on Monday are people who got an exemption, not people who are just simply refusing to get vaccinated. How is that fair? Why can't you accommodate those individuals in some way? Double masks is something that teachers are going to do. Some fire departments are saying you can be unvaccinated, but you can't eat in the same room with your fellow firefighters.
We have made decisions based on two principles, one science and the other law. And the science has shown that a vaccine is a more effective tool to prevent infection of other people and to prevent the infection of yourself. And if you become infected, to reduce the time that you are infected and transmitting the disease. That's the science. The law is that we have followed the law about accommodation. I'm confident that we have followed the law in that regard. And we've also made a decision on our experience, where we tried masking. We tried it in our Department of Corrections. It did not succeed. We had deaths. Deaths are a scientific fact. And we made decisions to avoid that in our state employment and our exposure to the public. So we think the science and the law is clear, and we followed both.
What do you think of school districts that are, according to OSPI, allowing frontline workers to continue unvaccinated in frontline positions then with additional safety measures in place? What I
think is that we have made a decision based on the science and the law as it applies to the state of Washington. The school boards may have made some different decision. I can't speak to that. But these are agency by agency decisions. Our agencies have made individualized decisions depending on the employment and pursuant of our understanding of the law and our belief in science and our willingness to be committed to both of those things. And because we have been committed to that, we have saved thousands of lives in this state. Thousands of lives we have saved because we have been committed to science. And some people have not followed science. Some people have taken the easy path. It's easy to do things that don't follow science, and the consequences of that is needless death. So we have decided to prevent unnecessary death, and I believe we're doing the right thing just like we have in the last year and a half.
Just a quick follow-up, though. If you got to 90%...
What, did you win the lottery here, Austin, or something, or what?
What is the value at this point, though, of losing 5,000 employees who got exemptions, who for religious or medical reasons, in the case of the medical one, their doctors have said they shouldn't get it. What does that accomplish towards your ultimate goal as those 5,000 people now go unemployed and unvaccinated?
Our goal is to have vaccinated public employees so that they will not infect the public. And we have found a very effective tool, which is to make it a job requirement to be in the job. It is a fair thing not to allow public servants to infect the public. We want to serve the public, not infect the public. That's why this is a job requirement. And if people do make a choice to leave service, we will replace them. We will find other people who do decide to become vaccinated, because we believe it's our obligation to be fair to the public and do our jobs, and that will accomplish both of these ends.
Or Q13, do you guys have anything?
Governor, I want to go back to your comments regarding the disruptions to state services, which I know that you said are not going to be massive, but state ferries have announced they're cutting back on some service starting Saturday. I know that's not entirely because of the vaccine mandate, there's several other reasons involved in that, but how is that not significant? And is there anything that your office or the state can do to try to address what has been a very much ongoing problem for that particular agency?
Well, yes, you're correct. There are many reasons the ferries have been stressed. There have been staffing challenges. There are mechanical challenges with an aging fleet. One of the things we're doing is asking the legislators for enough money to help fix these problems. Unfortunately, the legislature has not appropriated what I have suggested we need to fix those problems. And I hope that come January, they will be more attentive to helping us fix these problems. That's one of the things. The ferry system is and will have an accelerated recruitment program for staffing to find people for these jobs. And we also, I think, are going to need to look at the staffing model that the ferry system have to make it a more attractive place to work. But to change that staffing model takes additional dollars, and the legislature is going to need to help solve that problem to make it a more attractive place to come to work. That has been a long-standing challenge for the boats. The ferry system did make a decision because we had problems the last 2 weekends. We believe that some of the problem were people who wanted to demonstrate their displeasure with this requirement, and so they were unwilling to come to work those 2 weekends. We didn't want that to happen again this weekend, so the ferries made a schedule change temporarily, and I believe it will improve over time. I may also note that the ferry system will attempt to add boats on a daily basis, so people who are interested in schedules go to the website, because there may be additional boats available in the next a few days on a daily basis.
How long do you anticipate, not just with ferries, but the other agencies that are being impacted by the deadline item, how long do you anticipate the impact of losing employees to ferries, for example, losing potentially state troopers? How long do you anticipate the impact of that will last?
Well, we hope it's a positive. By the way, sometimes people forget when a Department of Corrections official dies, that takes them out of service permanently. We're trying to prevent that. We lose tons of hours right now because either people die or have to go to the hospital or are sick, and then we have to quarantine them and everybody around them. So by getting more people vaccinated, we reduce time loss of our employees, and people sometimes just totally forget that. This is designed to improve services long term. Now, there may be some stresses for some period of time. We'll have a better assessment of that next Tuesday when we look at our final numbers. But as I've indicated, we can manage this. The state typically has 10% turnover every year. So the state knows how to manage turnover, and we've had about 10% every year. We're going to have well less than 10% turnover associated with this. We're already over at 90%. That's going to improve in the next few days. 91.7% of people have been vaccinated, I know today, or have an accommodation, and that's going to go up. So this is a manageable thing for the state of Washington. And again, I want to thank the public employees who made that possible by getting vaccinated. So we're in good shape. Message, good shape in the state of Washington, steady as she goes. We're going through some choppy waters, but we're going to continue on the course we're on.
Q13, did you have anything? No? Okay, you get everybody in the room? All right, let's switch to the people on the phone.
First, we'll go to Elise Takahama from the Seattle Times. Go ahead, Elise.
Hi, yeah, thank you so much for doing this. I'm wondering a couple of things. First, will negative results from both PCR tests and rapid antigen tests meet this requirement? And then also, what do testing resources look like throughout the state right now? We were hearing about some shortages in testing staffers and rapid tests in particular last month.
Well, we've had some limited concern about that, but not an extraordinary amount. And I would just say to those who are expressing concern about supplies, they should contact their Department of Health. They've been very alert to try to plug those gaps. I don't think there's any systemic problem on testing supplies at the moment. But we will be alert to any location that thinks we can help in that regard. I'm not sure that we have identified the exact test that we will accept. We'll have further information on that in the next few days to get an answer to you.
Thank you. Governor, and I apologize if someone has already asked this at some point, I just don't know. Will any of these state workers who lose their job for not getting vaccinated, is there any unemployment available to those folks?
There is some possibility, but not a probability, and it will depend on their individual circumstances. It's a very convoluted decision. I think that most people who walk away and voluntarily resign will not receive unemployment compensation. The large majority of that will not receive it. But there may be some circumstances where they could qualify, so it's not an absolute black and white.
We have time for a couple more. Up next, we'll go to Kate Smith from the Yakima Herald. Go ahead, Kate.
Hi, Governor. Thanks so much for taking the time to answer some COVID-19 questions today. I have a slightly tangential question. What progress has been made statewide on the distribution of rental assistance funds since your last press conference? And will you extend the eviction moratorium bridge beyond October 31st?
At the moment, I don't think that is a realistic possibility. I have not had any recent updates about the assistance. I know I'll get that in the upcoming weeks, but I don't have any new news to share with you. But I don't think that I can think of a circumstances where we could extend that further. When we get some additional information about the distribution, I will share it with you.
The last question comes from Joey Thompson from Puget Sound Business Journal. Go ahead, Joey.
Hi, thanks. Governor, one of the things business owners have shared some frustrations about with vaccine verification is that, especially at larger events, it can cause real log jams with folks, and they're trying to find an easier option. Is there any update on if the state is, planning on some sort of, maybe it's a digital QR code where it shows your license and your card in one, as opposed to having to take each out, have the person check the name on one and then the other? Just to speed that process up for folks. And then second off, has the success of the state worker program influenced your decision on vaccine mandates in the broader public, as opposed focusing more on employer as opposed to, bringing that restaurant, bar, hospitality, to a statewide program?
Well, yes, it has demonstrated the wisdom of having a job requirement, because tens of thousands of people decide to get vaccinated, which is the goal here, and maintain a healthier, safer workforce. I don't know how to characterize this as other than an unqualified success. Now, we are not the only organization who has had an unqualified success. I look at United Airlines, which is like maybe 98%. Quite a number of hospital associations have had great success around the United States as well. So I think that our success is something we need to consider about extending this into the private sector. I do hear increasing number of voices in the private sector who, in some sense, think this is the right decision. And as I indicated, we'll be giving close consideration to harmonizing the state rule with our rule when it comes out. On the QR code and the like, I wonder if Dr. Shah can address that.
Thanks, Governor. So thanks for that question. So yeah, we have been working very diligently behind the scenes with a number of technology partners and solutions so that we can do exactly that, which is to have a digital verification process. As the governor already mentioned, you can go to MyIR right now to be able to get verification, but we want to make a more digital savvy, a more technology savvy solution. We don't have that update today, but I will say that that has really been exciting with all the different work that's been happening behind the scenes. We're also working with a couple other states in addition to our local partners, and really feel very, very good about the process that we have. We're really feeling that ultimately what this is going to be is an easier process for people to have an option to be technologically savvy when it comes to verification. So right now you can still have a photo of it on your phone. You can obviously have your card that you got when you got your vaccine. There are other ways to get verified, certainly going through our Department of Health website, but we want to also add this additional solution to it as an option. We're not quite there yet, but we're looking forward to being able to provide some great, fantastic, positive updates coming forth soon.
Is the reason to do that so that you can then have a statewide mandate for vaccination status to go into restaurants and bars as some counties are doing?
So the reason to do that is actually so that we can make it easier for a lot of what we're hearing from our Washingtonians, our consumers, our public, which is they want to see a potential solution that we can have that's not just working in one county, one community, one jurisdiction, but it's a statewide solution. Again, people can still have their cards, they can still do other things today, but this is an opportunity to really serve the public better. So that's the reason for it. That's the goal, and we're continuing working along that path. Did you want to?
Thank you, yes. I just really,
Introduce yourself.
I'm Nick Struley, Governor Inslee's Director for External Relations, and I wanted to just quickly mention the question seemed to indicate that there would be some proof of identification in addition to the proof of vaccination, and our requirement will not require individuals to show proof of identification. It is just a proof of vaccination status. There will be no ID that needs to be shown as part of that requirement.
Final words, Governor?
Yes, just a note. I will say from personal experience, when you go to a funeral service or a memorial service, as I have in the last couple of months, and you see the grief that a family experiences from a preventable death, it causes a pain in my heart more than anything I've certainly experienced in public life. And we have been making decisions in our state to not allow preventable deaths to the extent we can, and we're making those decisions today. And I'm pleased that we can show that those decisions are working because they're saving hundreds, if not thousands of lives by increasing the vaccination rate. And I know that people are frustrated that we have been in this period of so many months. We've experienced anxiety, frustration, loss of sleep. It's been really, really hard on people. And we continuing now are asking people to help out by getting vaccinated. That may be hard for some people. But I will say there's one thing I know: when you've got your opponent down on the canvas, don't let them back up. And we are not going to let this COVID come back up. And we will continue on this path to increase our vaccinations, and we hope people will help themselves by doing so. This is a safe, effective vaccine. It is massively saving lives. Do not listen to the baloney on the internet. There is more baloney in the internet than any 1,000 delis in New York City. Listen to your doctor. Listen to the science. They will tell you this is a safe vaccine. They will tell you it's saving thousands of lives. Protect yourself, and we'll be a better state. Thanks a lot. Be well.